Well, welcome back. If you or you know someone who suffers from an irregular and often rapid heart rhythm, they could suffer from atrial fibrillation. AFib affects nearly 40 million people worldwide and 6 million in the U.S. alone.
This can be serious as it causes poor blood flow, leading to blood clot, stroke, heart failure, and other heart-related complications. Bon Secours bringing awareness to new treatments that could help change lives. Dr. Bowie is the director of cardiac electrophysiology. Thank you. I said that right?
Yes.
All right, good. Thank you so much for being here. I mean, for viewers out there watching who may be a little unfamiliar, what are the signs of atrial fibrillation or AFib here?
Yeah, so thank you for having me. Atrial fibrillation is a chronic progressive disease. It's the most common abnormal heart rhythm in the general population. As you mentioned, some of the major factors, it's an irregular heart rhythm that increases your risk of stroke, heart failure, has the ability to weaken your heart function, as well as leading to other cardiovascular complications. And symptoms can be variable from palpitations, chest pain, shortness of breath. There's a subset of patients that might not feel much symptoms at all.
And what do treatments look like for AFib?
Treatments can be the traditional medical management, along with further advanced therapy. The gold standard remains to be catheter-based ablation procedure.
Okay.
And the foundation of catheter-based ablation has always involved the use of thermal energy technologies through freezing, cryoablation, or heating, radiofrequency ablation.
So Bon Secours St. Mary Hospital was one of the first hospitals in the state to perform a new FDA-approved procedure treating AFib called pulsed field ablation.
That's right.
Tell me a little bit more about that and why. I mean, I have to assume that's a great mark for them being one of the first.
Mm-hmm.
Yeah, so recently FDA approved a new technology called pulsed field ablation, also known as PFA. And in fact, Bon Secours St. Mary's Hospital was the first in the state of Virginia to perform this procedure on 4 patients on February 22nd. It's very exciting because pulsed field ablation is a groundbreaking new technology where it uses pulse electrical fields rather than thermal energy for the treatment of atrial fibrillation. And what's unique is this technology is cellular selective. So by using this pulse electrical field, cardiac myocytes are targeted while sparing localized or adjacent structures such as the esophagus or nerves that usually when we use thermal energy, we have to be very cognizant in preventing collateral injury to these structures. So the main emphasis is safety, and there will be many other iterations of this type of technology to come in the future. So it's an exciting time for us.
Now, what's the recovery process look like for this treatment?
Yeah, so we've been following all of these patients post-PFA ablation beyond just the first 4, and they're all doing very well. The procedures are less than 2 hours. All patients have been discharged the same day, and they've resumed normal activities. So overall, things are going very well.
Good.
And a success rate on that?
Success rate in terms of ablation in itself, we usually we talk about it as a disease-modifying process. There's no cure for atrial fibrillation, but we use all of these technology to modify the disease, and we know that we can safely and efficiently reduce the burden of atrial fibrillation, decrease the risk of stroke, heart failure. And so we're very excited to offer this new technology to our patients and have access to it and continue to be a leader in innovation in cardiac care while promoting safety and cardiac medical excellence within the region.
I think a question that I have is people who may experience heartburn or anything like that, or maybe some type of irregular heartbeat. When do you know that it's important to go see a doctor?
Yeah, that's a very, very good question, because I think what's different now, whereas 5 or 10 years ago, is that the advent of technology like the Apple Watch or certain cardiomobile apps that's available to the general population, it has led to earlier diagnosis of atrial fibrillation, where I tell patients if you don't ever see a doctor, you don't have high blood pressure or diabetes, because you don't have to feel it. So the nature of it is, I think, just if you have symptoms, call call your primary care doctor, and if any of these new technologies make sense to have them in your daily life, it can usually lead to earlier diagnosis and ultimately referral to us if needed.
Well, Dr. Bowie, thank you so much for coming in.
Thank
you for talking to us about all this. I mean, this is some very interesting stuff. I'm glad that the hospital is being able to do this right now.
Yeah, it's a very exciting time. I'm happy to be here. Thank you for having me.
No problems. Appreciate it. Time now for a check of the weather.